On May 29, Nigeria will see another 4 years of a new government. Barring any upset from the judiciary, Bola Tinubu will be sworn in as president, who will meet an ailing health sector and a mass exodus of doctors from the country. Arise Health correspondent Olije Wapera looks at Tinubu's national agenda and his plans for Nigeria's health sector as seen in his manifesto.
Buhari-led administration for the past 8 years created intervention programs to meet the needs of the health sector. However, healthcare systems in Nigeria is still confronted with a number of challenges ranging from inadequate funding to insufficient healthcare personnel, high maternal and infant mortality rate, and the brain drain as doctors and nurses flee the country in search for greener pastures. President-elect Bola Ahmed Tinubu's health agenda seeks to cover at least 40% of the population within 2 years by scaling up the National Health Insurance Scheme, increase home ownership for healthcare workers, upgrade staffing of the general hospitals in every local government area, build world-class specialist hospitals in the 6th geopolitical zone, increase healthcare workers and job creation incentives, salary increase, improve data collection and analysis, domestic manufacturing of essential medicines and vaccines, amongst others. What then are the expectations of Nigerians? Do the president-elect plans for the health sector to go far enough? Will they resolve the seemingly intractable challenges facing the sector?
The medications we use, 60% of it actually come from outside Nigeria. And I take a look at it also that if those countries where those medications come from, they are in trouble like we have in Ukraine and Russia now. We will not have access to medication, and when there's no access to medication, the whole country is in turmoil. As we speak now, we are not completely covered, and it's difficult for an average person to pay for health services out of pocket. When you have a pharmacy graduate that does not have job within 2 to 3 years, the individual start thinking of an alternative. Then we take a look at issues of medication regulation by National Agency for Food Administration and Control, NAFDAC, then the Pharmacist Council, and that of the NDLEA. We should regulate medicine more.
What we are seeing today does not suggest that in the past 8 years, this current outgoing administration has done anything fantastic. Looking at the indices, more doctors are living today than they were living last year. Leadership and administration, you must get it right by putting the right people in the right place to head institutions. And we expected to see in this manifesto how much are you voting to the health industry. We already have a benchmark set by the African Union since 2001. In the health industry, we don't expect political statements. We want facts and figures. Leave decision-making to professionals who are sufficiently trained to know what to do and how to do it and at the right time.
In order to get it right in the health sector once and for all, concerted efforts from all stakeholders to improve the healthcare outcomes for all Nigerians remains crucial. Olije Wapera, Arise News.
We're joined now by the immediate past Secretary General of the Nigerian Medical Association, Dr. Phillips Ekpe. Good to see you. Thanks for your time.
Thank you.
And I know these are times that your colleagues are really a little bit apprehensive and concerned about development in the sector. But again, we have a potpourri of issue on the plate. Apart from the manifesto of the incoming administration, there are also talks in the assembly about doctors, and also doctors are calling for a review of salaries before this administration winds down. Now, pick it from the plate, the topmost, if you will, in order of importance.
Well, thank you very much. Indeed, the health sector is in dire need for review and reform. As you know, the statistics, Nigeria is fourth from the last when you come to health indices. So any government coming in next have to really do something about it. When you look at the government of a nation, the first thing you should look at is education, the next is health. Then you talk about economics and then defense. If you are able to tackle these three, I think the country will surely develop. So you come to the health sector in Nigeria, it's really abysmal. I will tell you the maternal mortality rate right now is about 570 per 100,000 live birth, which is about the worst, in the world, And the infant mortality rate is about 55 per 1,000 live birth. The perinatal mortality rate is about 130. These figures are crazy figures. These are figures that you cannot see in the Western world. Where you are comparing Western world, for instance, maternal mortality rate in Western world ranges between 4 to 12%. Hardly will you get anything above, 4 to 12 per 100,000 live births. You can imagine that scenario. But if you look at it, I think, how do we change the healthcare sector of Nigeria? The first thing is to look at the patient-centered care, the Nigerian people. Any government that does not have a plan to take care of Nigerians actually do not love its people, because health is very, very important. We're all here because we're healthy. The military are fighting because they're healthy. Even the leadership, if they're not healthy, they won't be able to run the government.
And we wouldn't be here if we were not healthy.
So the first thing to look at is, how do we have universal health coverage for the country? Right now, the health insurance, which is the major solution to universal health insurance, is very also abysmal. The formal sector is less than 5%. The informal sector is almost less to nothing. And if you remember very well, the current president, gave an assent to mandatory health insurance, which means that people, the whole citizen, should have some level of health insurance. And health insurance helps those who have to pay for those who do not have. But how is it being implemented? Nothing has been done as such. I think it should be forced down. It should be forced down in such a way that if you want to open an account, they ask you, bring your health insurance. If you want to buy any good, where's your health insurance? If you want to get into admission, bring the health insurance of your parents. If you want to get a job, where's your health insurance? Once you do that, I think that that will bring up the coverage of health insurance in this country. There are efforts, but it's not enough. The federal government is doing their own effort, and then the state government, are they following suit? So it is very, very important that we look at universal health coverage vis-a-vis having health insurance and other ways of, But if you go further again, remember in 2001, the African head of state met in Nigeria and had a declaration that the budget for health should be 15% of the total budget of the nation. But since that time, 2001, Nigeria has never gone beyond 6%. How do you now expect it to be better? So, and then with all this, you find out that the health sector may not work so much. So you have to look at it. What are the other issues? Every time you're shouting brain drain and then medical tourism. Look, if you do what I said, and then you look at the remuneration, is very, very important, and equipping the hospitals. That solves the problem of brain drain.
Sulai, when you asked him that question, you addressed the most important ones. Yeah. Apparently, everything on his table is actually very, very important. Let's talk about primary health care.
Yes.
A lot of experts like yourself would say that is the foundation for any, health.
Definitely.
Yes. What needs to happen there? You talk about the states. Are they not the ones who really should be driving the issue of primary health care?
Thank you. There should be a cooperation between the state, the local government, and the federal government when it comes to primary health care. It cannot be done by the federal government alone, neither can it be done by the state alone. You also need the local government for it to be done. Primary health care basically means if normal ailment, the basic ailment that affects majority of people, over 80% of the persons, and you see them even beyond the urban areas. It's more in the rural areas, in our villages. And if the last time that was properly done to some extent was during the time of the Minister of Health, Professor Olikoyora Sankuti. After then, nothing. There have been so many programs where implementation has been a problem. Over 70% or even up to 80% of our primary health care in Nigeria are not manned properly by by doctors. There are no doctors. Even the other healthcare personnel are poorly remunerated. The equipment are abysmal. In some places, are even used for some of the buildings meant for primary health care, are even used for other activities. Yes, I know that the current federal government did a little effort, to say what can we do, but I think that much more has to be done until they place health as a priority.
An agenda for the incoming administration now. I know, Tinubu's talked about mandatory health insurance, and of course, he also promised that he will do everything, that health will be priority. If you were given the opportunity to draw up a plan of action for the next administration as far as health sector is concerned? What would be...
Two things,
Yeah.
or rather three things. First, health insurance, to even cover the informal sector, including the rural areas, the villages. If possible, make it free if you can, you know. Two, strengthen the primary health care by all means, such that for every 30 minutes walk, somebody can get in the health institution that is well funded, that has adequate human resources, and has enough equipment to be able to take care of our people, you know. Then, secondly, you must look at healthcare sector as a priority. What do I mean? I mean, healthcare people should be earning like NMPC staff, should be earning like CBN staff. I mean, there's no reason why they should, because this, if you notice, the NHS in the UK provides the majority of employment for the United States, for the United Kingdom. And so when you want to even create a job opportunity, this is an opportunity for a government to create job. You know, remember when you talk about National Health Insurance Authority or NHA, it's not just doctors and nurses that are working there. Also, there are a lot of auxiliary workers, you know, lawyers, you know, computer scientists, all sort of persons, you know, can come to work there, and that can mop up, you know, probably more than 10 to 20 million persons.
Speaking of personalities, quickly here, because you're an O&G expert,
yes,
and we've also heard a lot of your colleagues and a lot of doctors speak of the time of Professor Oliko Ransom Kuti.
Yes.
And it's amazing that till this moment, we've always had doctors as ministers, medical doctors now. What are those things that they would have done, to build on the gains recorded by the revered Professor Ransom Kuti?
Well, my view is that leadership is like a pyramid. The topmost, the peak is very, very important. And the political will of that peak is very important for it to condescend to the other persons. You see, even the other ministers, with the willingness, not all, but I mean quite some of them, with the willingness and readiness to do what they're supposed to do, because of the poor political will from the upper leadership to say, okay, this is what we need, we are ready to give it to you. They are not able to perform. But remember that when Oliko Ransom Kuti was coming, he said something before he accepted the appointment. Please, will you allow me to run it the way I want it run? Will you give me a free hand? Otherwise, I do not want the job.
Right.
And so we need such
he had a
personality.
vision. I
Yes.
mean, when you have a vision, it's
Yes.
easier to make that. But let's find out what's happening in Ghana. Yes, Ghana has become the first country to approve a new vaccine.
Well, Ghana has become the first country to approve a new vaccine for malaria that researchers call a world changer in the battle against the virus, one of the leading killers of children in Africa.
Yes, indeed. And the vaccine called R21 appears effective compared to previous trials. It's been approved for use on children aged between 5 months and 3 years. The World Health Organization is also considering approving Oxford University's vaccine developed in the UK. The Serum Institute of India is preparing to produce between 100 and 200 million doses per year, with a vaccine factory being constructed in Ghana's capital, Accra. How do you feel hearing, Ghana, barely a quarter of our population.
I think
gone ahead.
Yes, I think the issue here now, quickly, sorry to cut you, Ngozi, has to do with, first, we have 3 medical doctors in this administration. You have medical doctors. We're talking about Dr. Mamora. We're talking about Dr. Chris Ngige, Dr. Ehanire. And now Nigeria missed out on the second window to get on the malaria vaccine trial.
Well, thank you very much. It's not too long that this vaccine was invented, and it's not too long that it was approved. The countries varies. You are not going to compare the population of Nigeria to that of Ghana. And also you have to, like I mentioned before, you have to look at the political will. I agree. I mean, it starts from somewhere, you understand? Some places that are not, the bottlenecks are very limited in order to achieve what we want to achieve. But like I also said, there is a need probably for the current Minister of Health and also the other doctors to impress it on the president, who is not a medical doctor, to say, look, this should be a game changer. This is what we should do. I know that Nigeria have been discussing issues on vaccine production, you understand, especially vis-a-vis the advent of COVID-19, and there were a lot of hula-bula about let's start producing vaccine. But of course, bottlenecks, logistics, personal interests had stalled it.
Well, you would agree we have a malaria problem in Nigeria.
No, it's not. We have a malaria problem in Africa. And
no, I'm restricting it to Nigeria now because knowing that the country missed out on
Nigeria
the second window.
is a big population in Africa and West Africa. And so if you remove Nigeria alone, that means the problem is highly reduced. So Nigeria is a big burden, has a big burden of malaria, in Africa.
And the WHO had pointed out
the vaccine for malaria, against malaria parasite, is a game changer. It will definitely have a big effect, in improving the health of Nigerians because, if you go to the general practice clinic, the commonest diagnosis is malaria. I mean, it's about 70%.
Absolutely.
And of course, Nigerians have even learned to treat themselves, and they've also maybe developed some level of immunity, but they've learned.
But doesn't that create another set of problems, at another level entirely? I know the WHO did warn Nigeria to fix, infrastructure to accommodate this, malaria vaccine infrastructure. But alas, here we are. But we'll have to leave it there. Dr. Phillips Ekpe is a gynecologist, immediate past Secretary General of the Nigerian Medical Association.
Thank you.
Thank you very much for joining us on Newsnight.